or any time?
Sir, just 5 minutes, sir, because we announced it for 7 o'clock, no?
Okay, okay.
Just 5 minutes, sir. People will keep joining, sir, now.
Or any time.
5 minutes, sir, because we announced for 7 o'clock.
Okay, okay.
Just 5 minutes, sir. Doctor, webinar starting join అవ్వండి.
హలో
1 minute.
హలో
డాక్టర్ వెబినార్ అదే ఫస్ట్ అన్ని గ్రూప్స్ లో పెట్టండి. జస్ట్ put it in all groups. Webinar started. Sir, shall we start then? Hello, sir. Fanin, sir. Fanindra Kumar, sir. Sir, you are in mute, sir. Can you unmute yourself?
Yeah, you can start introduction. I will start.
Yeah, yes, sir.
Start introduction.
Yes, sir. Good evening, everyone. I am Dr. Nagendra Kankipati, founder and president of Telangana Audiologists and Speech Language Pathologists Association and Universal Association of Clinical Audiologists. First of all, happy National Speech Language Pathologist Day to each one of you. Today, on this occasion, we are going to conduct a webinar on critical. One second. Webinar on critical role of SLP in the management of voice disorders. We have got a resource person, Professor Dr. V. Fanindra Kumar. Sir is having so many years of experience. He is the senior laryngologist and phonosurgeon and director of Melody Voice Clinic. He is currently consultant at Century Hospitals, Hyderabad. I am going to share the sir's CV for all your information, and I request everyone to keep your mic on in mute and also keep posting the questions in the chat box. We will take the all questions at the end of the webinar. Thank you.
Now you can share my screen.
Yes, yes, sir. I'm sharing the screen, sir. Can you see, sir?
You can see. No, I want to share my screen. You have to enable me to share my screen.
Yes, sir. I am going to give you
Share
an introduction about you, sir. Your CV.
Okay.
Can you see the CV on the screen, sir?
Yeah, I can see.
Yeah. So about Dr. Fanindra Kumar, sir, I want to tell to everyone. Professor V. Valluri Fanindra Kumar, sir, qualified from MBBS in 1971 and for MS ENT in 1976 from Guntur Medical College and Andhra University. He retired as professor and HOD ENT Guntur Medical College in 2002, Emeritus Professor ENT Guntur Medical College. Director Sri Satyasai Institute of ENT and Melody Voice Clinic Guntur, Andhra Pradesh and Hyderabad, Telangana. Founder, President and Chairman, Governing Council, the Association of Phonosurgeons of India, known as First Voice Surgeon of India and Father of Phonosurgery. Personal voice doctor for famous cine playback singer, late Sri S.P. Balasubramanian Garu. President, Indian Chapter of Voice Foundation, USA. Elected faculty, Academy of Middle East Otolaryngology and Head and Neck Surgery. Advisor, Scientific Committee, World Voice Congress 2010, Seoul, South Korea. First ENT surgeon from India who successfully performed the combined thyroplasty type 1 and arytenoid adduction surgery in Indian scenario in 1996 and published it. Organized the first All India Phonosurgery workshop in 1999 at Guntur Medical College. First laryngologist from India to introduce transnasal endoscopic office-based laryngeal surgeries in 2005 and performed more than 8,000 office laryngeal procedures. Introduced for the first time in the world concept of office-based cordotomy for bilateral vocal fold paralysis and presented it as invited guest speaker in American Academy of Otolaryngology and Head and Neck Surgery in 2019. Invited faculty in many national, including AIMS New Delhi and international conferences with publications in national and international journals. Thank you so much, sir. We are very fortunate to have you here today as a resource person, sir. Thank you so much. Now I am making you as host. You can share your screen now. Sir, you are the host, sir.
I can share the screen now.
Yes, sir, please.
Thank you. Thank you, Dr. Nagendra, and for giving me this opportunity today. First of all, let me wish you all the happy National Speech Language Pathologist Day. Today, the topic given to me is about the critical role of uh, the speech language pathologist in the management of voice disorders. You know, the human voice is the product of sophisticated interaction of aerodynamic and myoelastic forces. Voice assessment is essentially a multi-dimensional, multi-professional, uh, with a dedicated team like otolaryngologist, speech language pathologist, and a singing teacher. Speech language pathologists play a major role in the evaluation and treatment of voice disorders. Speech language pathologist who has specialized in voice area is called as SLPV in Europe. So this point you must know that speech language pathologists who are specialized in voice they are called as SLPV in Europe. So this type of concept also we should develop in India. Now, to understand the role of CLP in the treatment of voice disorders, all CLPs must know first the physiology of voice production, what are the various causes of voice disorders, and how to diagnose them, signs and symptoms of voice disorders. Then only it is possible for the to make a proper therapy program that can be tailored to the patient's specific needs. Coming to physiological basis of the voice, this is very important to understand exactly the voice disorder. We must know there are three steps in the voice production. One is generation of voice by generators of voice power, that is the lungs. Next, we have the vibrators, that is the vocal cords, where the vibrations produce the sound. Finally, the beauty of the voice comes from the resonators or articulators, which are the false vocal cords, pharyngeal walls, palate, tongue, lips, and jaws. Ultimately, the voice, most important is coordination from the central nervous system of the brain. Now, let us see one by one the generator of voice, how the lungs will help in the voice production. So once you can find this here in this picture, you can find video. The lung is pushing the vocal cords from below by pumping the air. See how they are going. So with this subglottic pressure, by the pressure of the air, there will be vibrations of the vocal folds like this. This is called generation. First step in the voice production. The next one is uh, the vibration of vocal folds. Here you find the two. Suppose these are two vocal cords. You will find the vibration here. When they vibrate, they come very close to midline. See the vocal cords here you find. When they vibrate, they come too close to midline like this and then vibrate. When they want to give respiration, they go apart. So this is the function of the larynx. That is, one is the respiration, another one is the voice production. The third one is, of course, resonators and articulators. I told you all these things, they add beauty to the voice. Now, this video shows actually the live in the movements of the vocal cords, how they vibrate. This is the stroboscopy. It's slow moving video picture where you find the live vocal cord movements here like this. Next, coming to the causes for the voice disorders, we can classify the voice disorders as functional and organic. And you must know it is sometimes difficult to demarcate them as one may predispose the other. Coming to organic voice disorders, that is congenital and acquired. So in the congenital voice disorders, the commonest is the laryngeal web. You can see the picture here. Both vocal cords fused by a web formation. So there is no demarcation between the two vocal cords. This gives not only the voice problem, but breathing problem also for the child. The acquired voice disorders are traumatic, that is by injury, inflammatory, that is infections, neoplastic, that is tumors. Tumors may be either benign or innocent tumors like papillomas, other things. or malignancy, a carcinoma, a cancer. This picture is the cancer of vocal cord here, you can see. And other causes will be neurological, like vocal cord paralysis and other miscellaneous causes. Now, the void disorders, otherwise called as dysphonias, they may be two types of void disorders, one due to vibratory problem, second due to the resonance problem. The vibratory are also called as phonatory void disorders. The commonest complaint in phonatory void disorders is the hoarse voice. The other things are scratchy voice, weak voice, stiff voice, breathy voice, painful voice. This painful voice, there is another term, this is called also called as odonophonia, and loss of voice, that is called as aphonia. A coming to resonance void disorders, which may be hyperresonance or hyporesonance. This hyponasal resonance can occur in case of cleft palate, as all of you must have experienced this in cleft palate hyporesonance. And you had other type of void disorder, pitch disorders, where the female voice in the males we call it piperphonia, that everybody knows. Similarly, male voice in females we call them as androphonias. And singers, they have special voice problems like the loss of range during the singing and vocal fatigue. So singers, dealing with singer itself is a separate subject. They come under professional voice users. And all SLPs must be trained how to deal with this type of professional people. SLP is the key person in the evaluation and assessment of void disorder patients with a special questionnaire forms for professional and non-professional voice users. This generally involves evaluating the voice characteristics related to respiration, phonation, resonance, as well as the vocal range and flexibility of the voice. So these are the factors which you have to look into the when you examine the patient. SLP makes voice assessment in 5 steps. One is history of the problem and behavioral data. 2, self-assessment, the impact of voice by patient himself by voice handicap index. And third one is the auditory or perceptual judgment by voice team and acoustic analysis, that is the digital voice analysis, and also the physical examination of patient. So correlation of all these steps with the medical diagnosis, only you can come to conclusion. So after conclusion with the above steps only, the SLPV should go through the reports of the laryngologist. Otherwise, you may get biopsy. Suppose you get a referral from an ENT surgeon or from a laryngologist. So don't go into the reports first. Don't see their reports. First, you assess the patient and decide what type of problem the patient having. Then only you can go for other things. The history of problem. Other things are the history of problem taken by SLPs. When patients complain of duration, fluctuation of symptoms, use of voice in the family, social, sporting, and other professional occasions, and voice use, whether it is artistic, where there are special artists like singers, actors, or non-artistic use of voice. As example, other professional voice users like teachers, lawyers, and salespeople, etc. The other vocal habits and use of tobacco and alcohol, communication attitude, different interpersonal relations, personality characteristics, previous episodes of voice problems, treatments the patient has taken, general health of the patient, any surgeries they underwent, and similarly, the loss of singing range, whether the patient is getting continuous mono pitch and continuous difficulty or continuous effort to talk, frequently clearing of throat. This is the one which we commonly come across in patients with void disorders. People who have this what is called reflex problem, that is gastroesophageal reflex problem, they go on clearing the throat. So with this, what happens every time when they clear the throat like that, what will happen? There will be the both vocal cords they hit each other, and there will be problem with the vocal cords. Next, self-assessment and impact of voice to verify the patient's experience in living and coping with the voice problem. This self-assessment is very fast and gives very good information. It gives validated protocols in patients, language, and culture. It is a great value and symptoms are difficult to measure objectively, such as vocal fatigue and vocal tract discomfort, etc. Many self-assessment questionnaires are available in practice. The common one is the voice handicap index and voice handicap index for singing. Classical singing voice gap index and modern singing voice gap index are also in practice as the self-assessment programs. Next, coming to the most important and commonly practiced thing by speech language pathologists and also by voice team is the perceptual, that is auditory judgment of voice. It is critical component of any voice assessment to describe type and degree of the deviation in the voice quality. This particular perceptual auditory judgment, it requires a special training experience that is called a ear training. So with the experience only who are experienced, the speech language pathologists or voice pathologists, and similarly the laryngologists who have a specially trained working for a long time and hearing the voice of different patients. So they can only assess this perceptual judgment perfectly. So it is considered as the most traditional evaluation method in a voice click and gold standard for documenting the severity of the voice impairment. Three types of voices we know. One is the rough in the consistent perceptual judgments. We know one is the roughness, breathiness, and strain. The most widespread protocols for the perceptual judgment are the one is the traditional GRABS, that is GRABS scale. The degree of deviation, that is normal or absence, is called 0. Mild is 1, moderate is 2, and severe is 3. So this is the scale which we commonly, all of us will follow. That's called GRABS voice for perceptual judgmental voice. The next one nowadays they follow is the modern KP scale, that is conscious auditory perceptual evaluation of the voice. To document and compare the pre and treatment data, we need what is called acoustic voice analysis, or otherwise also called as objective voice analysis, where you can record these voice problems objectively, and this is helpful to document the characteristics of the voice and by spectrograms, harmonic noise levels, and phonograms, etc. So this will help a lot. So this here find the acoustic voices graph here, and you can find here the spectrographic analysis here. So these are all commonly done in nowadays. The phonogram is just like audiogram, where the intensity frequency levels are measured to assess the vocal range, just like you do audiogram in your audiology clinics. Next, the other instrumental analysis. What do we do? This is actually this instrumental analysis in our countries only the ENT surgeons or the laryngologists are performing. But if you see in Europe and America and all the other countries, all the SLPs, mostly those who are trained in voice therapy techniques, or compulsorily they are trained in this laryngoscopy techniques. That is the video laryngostroboscopy or just video laryngoscopy and then flexible endoscopy. So all these people are trained, also SLPs, actually they were trained all these techniques. Now let us see this, what is this digital video laryngoscopy? You know that vocal cords usually move at the rate of 300 times, they vibrate at the rate of 300 times per second, normally in human beings, during the speech. And similarly, they vibrate at a frequency rate of 1,000 times per second during singing. So sometimes it is difficult to find out the minute changes or defects in the vocal cords, in the fast moving vocal cords, in such a by simple endoscopes. So the special instrument called video laryngostroboscopy is used in the voice clinics or either by a laryngologist or SLP to detect the minute defects in the vocal folds. Because this laryngoscopy shows the vocal cords in very slow motion so that you can find out the defects in the minute defects very much. Now let us see this video. Please see this video here. See how the vocal cords vibrating. Like you find the vibrations, there is waves of emotion here. See how they are vibrating. So this vibration can spell. This is not the mucosal wave. See this, the left vocal cord, there is a lot beautiful mucosal wave, and see in the right vocal cord, the mucosal is very much impeded by presence of a mass here. So this is mucosal factor very much lost. So there is a scale and there is a proforma for the stroboscopy, and I think every SLP must be trained in our country also in evaluation this type of thing. The next one is called dynamic endoscopic evaluation of voice, where we use the flexible endoscope. The stroboscopy is then usually done with a rigid endoscope, where endoscope is passed through the mouth and ask the patient simply to phonate, make vowels. But here in dynamic endoscopic evaluation, you find the flexible endoscopy used, where the endoscopy is passed through nose, and patient can have, he can speak or even sing during your laryngoscope examination, and you can assess this. This is very helpful in assessing the functional void disorders like muscle tension dysphonia. You can find here the singing endoscope, how we can find the
జీవము నీవే కదా దేవా జీవము నీవే కదా ద్రోచే భారము నీవే కదా.
so you can find when the patient is singing, you can live movements in the vocal folds, and you can see for any, look for any functional voice problems like muscle tension dysphonia. That is the greatest aspect of this one, and I think in our country also, yes, we must be trained in this type of work. Then coming to the, don't think that physical examination and touching the patient is only the job of ENT surgeon. Every SLP must know how to examine the neck, how to examine the larynx, and look for the cervical muscles, feel the neck, and feel the neck with your fingers for any tension in the muscles of the neck or any roughness in the cartilages like that. So like this, you can palpate. It's called palpation. You can just palpate with your bare fingers or with your gloved fingers also you can do it. So you get information over the adjacent structures, the neck, the shoulders. They are very important. The chest, how the patient, the pattern of breathing, how the breathing pattern is there, whether they being a normal abdominal breathing or making a clavicular breathing. Because these are all the things you have to inspect and see. Every SLP must be trained to see all these things. And similarly, you should look for any compensatory maneuvers. You can see the patients, particularly muscle dysphonia, they develop a lot of compensatory maneuvers, like they just turn the head to one side like this, and sometimes they keep the neck very stiff. So this sometimes it may happen. So these things also you can look for. So this is called to assess the compensatory maneuvers for the muscle tension dysphonia. And by correlating all these steps and all this process, then only we can come to a clinical decision about the patient information and come to a conclusion in the diagnosis. This is a combined effort done by a ENT surgeon or laryngologist and a SLPV. Now let us go into the treatment aspects of the modalities of the void disorders. The first and more foremost is the counseling and education patient, which is totally a job of a SLPV. This is totally a job of SLP, which are trained very well in the aspect. The next comes the foremost important is the voice therapy, a well-trained voice therapist or SLPV. And behavioral therapy, either it can be maybe done by voice therapist or if necessary by a psychologist. This is very, very important. So totally we call them as behavioral voice therapy. The other modality of treatment, the medical treatments are, one is the laryngeal injection techniques, and ultimately we got what is called phonosurgery or voice surgery. And please remember, there is no voice surgery without voice therapy. So there will be first voice therapy, and then phonosurgery and followed voice therapy. This is the usual, the sequence. So that is followed in the case of phonosurgery also. So this phonosurgery is the voice surgery done in patients with various voice problems. So these are several types in this. One is called laryngeal framework surgery, where the patient is operated on the neck under local anesthesia, and we make some alterations on the neck in the tension of by correcting the cartilage levels, and we correct the tension of the vocal cords and change the position of the vocal cords. But we don't touch the vocal cords. This is everything done in laryngeal framework, that is in the laryngeal skeleton only at the neck. So this is called as a laryngeal framework surgery. There are four types. One is called thyroplasty type 1. This is done for vocal cord paralysis. Type 2 for spasmodysphonia. Type 3 for fibrophonias. That is fibrophonia only when the patient will not respond to voice therapy, because most of the fibrophonics are behavioral, mostly like something, a behavioral problem. Patients, though, 90% they respond to voice therapy, behavioral therapy. But some people may not respond. So some people, they need surgery. Similarly, androphonia, that is male voice in females. And you have other type of surgeries, laryngeal cancer surgery. And latest is called office-based laryngeal surgery or awake vocal fold surgery, where the vocal fold masses you can remove from the vocal cords of patients when they are speaking or even singing. I showed for clinical interest, just I show briefly how this office-based surgery is being done. Here, when the patient can speaking, you can see, you can find the patient is actually can vocal cords will see, you can find a polyp here. So this is how the position, a small fiber optic scope is passed to the nose of the patient and reach the larynx. This is also done under local anesthesia. So you can find the vocal cords on the screen here. So the instruments are passed to the endoscope, same endoscope, and some see can the vocal cords moving now. That means patient is speaking. You can just remove that polyp without a little pain, even with a little pain, nothing, 100% painless. So you can remove this with the forceps, or you can also use a laser. So this is why I am showing briefly what is the thyroplasty here. So I told you this is the one you can find a thyroidectomy scar. The patient has a thyroidectomy operation and he had a vocal cord paralysis. So he lost the voice. First 6 months voice therapy was tried, but there is not much relief. So then we had to operate. So what we do here, we'll put an implant to make the vocal cord position in the laryngeal framework, and also we correct the position of the arytenoid here. See, these are
ఆరు ఏడు ఎనిమిది తొమ్మిది పది.
Okay. Okay.
See, this is one you have seen. This is very interesting. The neck is open and patient is speaking. You can tune the voice on the operating table like you are tuning in a radio. So that is very interesting aspect of this phonosurgery. So what are the results? Now here you can see various types of voice disorders, how they are treated and how they are corrected, and what types of voice problem they're having, and what is the graph scale in these patients, and what a problem. Let us see here now, one by one. So this is the case. This one, what I'm going to show, the first case is here.
My name is Bala Annapurna. I worked in Arvindo International School. I am a teacher.
Please just hear her voice. Just hear her voice carefully. She has very rough voice, graph scale, actually G, all 3 grades. She hang also she hang like a low pitched male voice like this. See,
As a teacher, I am suffering some throat change of voice and throat.
so after surgery, what could be the reason?
My name is Bala Annapurna. I am getting very good voice after phonomicrosurgery.
So this type of voice she recovered 100% because of not only the surgery but also the therapy. Please remember, because the modulation of voice is very important of surgery. This should be done by SLPV. So SLPV has a lot of responsibility.
I am very happy with my voice.
And most of the patients are very happy of treatment with combined phonosurgery and voice therapy. So the next one which I am going to show, this gentleman is age about 42 years. He came to me. When he was 2 years old, he lost his voice. Because he had got one vocal cord paralyzed in his childhood. when you were 2 years old. So when he came to me, his voice was horrible and you can't hear anything. So we did this laryngeal framework surgery or phonosurgery for him.
I am VN Raju. I have come from Montreal. Voice disorder since my childhood.
So this is also graph scale 3 degrees. All that is the roughness, breathiness, strain, everything you find in this case. You can see
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Today is 27th November 2005.
VN Raju.
the same patient after surgery, and then please remember this patient who had given voice therapy for 3 weeks or 4 weeks after surgery, then only got his normal voice.
From Montreal. During my childhood, my left vocal cord got paralyzed. I got it operated by Dr. V. Fanindra Kumar at Guntur. After the surgery, my voice is better. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 25th December 2005.
So this is a great effort.
Ah, ah.
So this patient was operated in the 2005. You know, sir, even today he is maintaining excellent voice after foreign surgery and then voice therapy. So that is see how much the patients will have a lot of gratitude for this one. The next one is the patient. This called, this is a voice, a typical.
పేరు కొండ రామిరెడ్డి 1 2 3 4 5 6 7 8 9 నా పేరు కొండ రామిరెడ్డి 1 2 3 4 5 6 7 8 9
See, people. So the people. Sorry. Anything? Okay. The people who don't know about what spasmodic dysphonia, this is a typical case of spasmodic dysphonia. This is typical case of spasmodic dysphonia. You can see there is spasms and voice breaks. You can hear it once again.
రామిరెడ్డి 1 2 3 4 5 6
So people who have not seen spasmodic dysphonia before, please remember this is a typical case of spasmodic dysphonia, a central nervous system disorder, and giving rise to spasms of the vocal folds and giving rise to stiff and spasmodic voice. This is called spasmodic dysphonia or spastic dysphonia. So these people, the same person after treatment, see how he can maintain
కొండ
voice.
రామిరెడ్డి 2/7 బ్రాడీపేట 1 2 3 4 5 6 7 8 9 10.
So this is after very good voice therapy and surgery. So this is the one how the patients can improve, but ultimately the voice therapy is very, very important. So this is the one interesting case. Another girl here you find here. She's having almost like a male voice when was studying some 10th class, something like that.
My name is Sita Nagalakshmi. I am 60. Place is Guntur. I have this voice. My name is Sita Nagalakshmi. I am 16 years old. My native place is Guntur. I have this voice problem since 18.
My name is Sita Nagalakshmi. I am studying junior inter in Guruvaya College. After the voice surgery, I am getting good voice.
So this is the one where we did type 4 theraplasty. The case, this we call it androphonia, no? That is the male voice and female, this girl. And typotheraplasty, same thing. Now we got voice corrections for transgender voice. That means the transgenders, we changed their sex from male to female. Now the latest thing is the transgender voice corrections. So we need people apart from the voice surgeons, very good trained SLPs in the transgender voice corrections. There is going to be a lot of need for this type of speech language pathologists in our country. So this is transgender voice corrections. And this is the one you know very well. This everybody can very commonly, most of must have seen the piperophonias, which I told you can be corrected most of the time by voice therapy.
My name is Ravi Kumar. I'm studying first year of MBA in Usmania University. I have come here for treatment of my voice. I have this voice problem since year.
I am from Hyderabad. I am doing my MBA from Usmania University. I am getting very good voice after treatment from Dr. Panindra Kumar.
So you have this is everybody must experience. Most of the people you have come across these people, paperphonics, the high pitched voice in males. Please remember, all high pitched voice in males are not due to paperphonia. There are other causes also, like sulcus vocalis and laryngeal webs, microlaryngeal webs, and short larynx, continentally short larynx. So these cases sometimes they do not respond to voice therapy. So they need a surgical correction. So all high-pitched voices are not due to piperophonia. So similarly, you have another high-pitched voice here. You find a patient here. This is the patient who has underwent surgery, the voice surgery here. You find here.
నా పేరు మురళీకృష్ణ. నేను ఏపీఎస్ఆర్టీసీలో కండక్టర్గా చేయుచున్నాను. మాది పిడుగురాళ్ళ. నాకు వాయిస్ చిన్నప్పటి నుండి ప్రాబ్లంగా ఉన్నది. ఈ మాదిరిగా కీచు గొంతుగా వచ్చుచున్నది.
After surgery.
నా పేరు స్వయంపాకుల మురళీకృష్ణ. నేను ఏపీఎస్ఆర్టీసీలో కండక్టర్గా పనిచేయుచున్నాను. మంచి స్వరాన్ని ఇచ్చి ఉన్నారు. ఆశ్చర్యకరమైనటువంటి విషయం ఏమిటంటే ఆపరేషన్ చేస్తున్నప్పుడు కొన్ని నిమిషాల్లోనే నేను మాట్లాడగలిగి గొంతు మార్పును గమనించి ఉన్నాను. నా జీవితం అంతా డాక్టర్ ఫరీంద్ర కుమార్ గారికి రుణపడి ఉంటాను.
So this shows how the people have gratitude when they change their voice and also their life. So the voice is not only changing their speech, but also changing the voice sometimes. Sometimes their life is all changed. So they have going to have very good fortune by changing the voice. So ultimately, the treatment with voice disorders is always a teamwork by medical management, surgical interventions, behavioral or voice therapy by speech language pathologists. So to conclude, voice disorder evaluation by speech language pathologists using perceptual, acoustic, aerodynamic, and laryngeal imaging methods, including the video laryngoscopy, may inform the diagnosis as well as document the nature and degree of the impairment of the voice, and also monitor the improvements related to the medical, surgical, or behavioral interventions. Evaluation treatment by SLP, now I call it as SLPB, has been shown to be very effective in a variety of patients, populations suffering with voice disorders. So ultimately, I would like to tell that SLPB or SLPs are the backbone in the management of the voice disorders. So this is very important. SLP, please note down, and you should come forward to learn this specialty of voice, and don't be continuously for audiology side, but look at the voice also. Thank you for your kind attention. Thank you very much. Any questions are welcome, please.
Hello, good evening, sir. I'm here, Arif. Yeah, it's a wonderful explanation of all the different voice disorders, sir. Really, it was so informative. I have small query about and small doubt about the success rate of different voice disorders. In your experience, which voice disorder has got more success rate comparatively with all the voice disorders?
You want the success rate?
Yeah, success rate of means which disorder voice disorder
The
has
success
more
rate of
success rate?
success rate of only the total voice disorders or about surgeries. What do you want?
Means any specific easier
Yeah. Actually, nowadays with all this sophisticated equipment and very good voice therapists and well-trained voice surgeons, the success rate is more than 80%.
Sure, okay, more than
More than
80%.
80%. More than 80%. But
That's
it is possible from a dedicated team.
Acha. Any duration, sir? Like any particularly this will be like months in months or days?
Yeah. See, the duration of this usually most of these disorders, for example, the laryngeal framework surgery, all these things, the result is instantaneous on the operating table. Suppose we operate the patient with vocal cord paralysis, which have a grade 3 or graph scale. So on the table, it will automatically come to 1.
Acha, okay.
On the table itself. And that 1 becomes 0 after voice therapy. So this is the sequence. But in some cases where there is a compensatory voice problems associated with the organic disorders, sometimes these people they require a prolonged voice therapy, maybe 2 weeks, 3 weeks, like that.
Acha, okay.
Sometimes they need 4 weeks also. So gradually you had to change their patterns and bring them to normal voice. That may take time. Actually, the voice therapy will take a little more time than the surgery.
Yeah.
And I am also telling you the success of the voice therapy and very has got a lot of role in the voice disorders. And most difficult aspect is voice therapy, more difficult than surgery.
Oh, yeah. Yes, sir.
More difficult than surgery is the voice therapy. But unfortunately, patient population don't know about this. So we must bring that awareness among the patients.
Okay. Thank you, sir. Thank you for your valuable information. Thank you, sir.
Any other
more
questions?
Any more questions?
Hello, sir. Good evening.
Yeah.
Very nice explanation. Thank you very much. You have given excellent presentation. Though you are a phonosurgeon, you have given very detailed explanation about the therapy and its prognosis, and also regarding the surgical aspects, type 1, 2, 3, 4, which is very what we call essential, and it is new to us all SLPs. And from SLP's point of view, to you, your good self, as a teacher for us all, and all our participants, and our TASALPA organizing committee, Dr. Nagender, Imad, and all the EC members, including Arif, and our Gangaraju, and many others, Venkat Narayana and others. I heartily congratulate them as an SLP, and wishes to them for this on this National Speech Language Pathologist Day. So coming to the question regarding the surgeries to puberphonics, and as just you have explained about regarding the paralysis cases, but what about the puberphonics and androphonics, and how to convince them? Few cases, as you said, I also always counsel them, it is voice therapy is about 80% success rate, and in 10 to 20% there are chances that we cannot do much, maybe because of, as you said, compensatory issues and other. So where the surgical aspects may be helpful. So coming to this puberphonics and androphonics, So when and which situation we can recommend them for the surgical aspects?
See, any surgery is done at the patient's will. When he has a will to undergo surgery, only we have to operate them. That is the fundamental thing for any surgery. So if the patient has an intention or he has strong desire to correct his voice, then he will come forward. But every patient will have a doubt, one doubt, whether this voice is corrected or the present voice also lost.
Yeah.
That is the common question they ask us. Sir, this whether you have this voice or this also we are going to lose. Then what is our fate?
Yes.
That is a common question, a common man's question. So we tell them, that is why we show them some cases already operated before treatment and after treatment.
Sir.
And that will give some confidence for them, number one. And tell them, see, for any voice case, we cannot give like any other surgery, 100% guarantee cannot be given.
Sir.
For any surgery in the world, no surgeon can give 100% guarantee. But in voice cases, out of our experience, we are telling you, so these are the patients who got benefited. We got a group of patients like this. If you want to see the videos and see, so you will be one among them because we record your voice also before treatment and we record after your treatment. So that will be the evidence for your success rate. Nothing we can tell you. That's what we explain to the patients.
Sir, thank you, sir. One more thing is the surgical procedures. We are not so interested to know in that, but few cases like where the surgeries are done, what happens is we see that hoarse voice is generated, and in treatment of hoarse voice also, I feel according to my experience, treating hoarse voice is more difficult.
See, that is what I am telling you. Surgery for hoarse voice, number one, the cause of the voice disorder. Okay. You and the surgeon's skill and experience.
Sir.
The most important thing is the voice therapy. If you operate and leave the patient like that, he will not improve.
Sir.
He should be given, if necessary, before treatment for the compensatory voice maneuvers therapy and post-surgical again therapy.
Yeah.
Then only that sustained relief for the patient will come throughout his life.
Yes, sir. Very nice.
That is the cause of failure.
Sir.
And most of the surgeons, sometimes they don't follow the meticulously voice therapy.
Yes, sir.
Except only the voice surgeons know the value of voice therapy.
Yes, sir. Sir, one more thing, sir, that what is the age criteria to select for these kind of surgeries? Any age criteria for certain disorders?
Any age after 10 years.
After 10 years.
10 years means, I mean, certain surgeries. For example, a polyp, a vocal cord cyst, a child having a vocal nodule, not corrected by voice therapy. See, I got a series of pediatric voice disorders, a separate chapter. I had some talk on that.
Sir.
How I operated pediatric patients, how they relieved, and how you give pediatric voice therapy. That is also a separate topic, so we can correct. And for the upper age ability is nothing. We can operate any age up to 8 years. We can operate.
Sir.
We can operate up to 8 years.
Okay.
But the external surgeries in children we don't do because there is growing larynx.
Yeah.
So we don't disturb the growing larynx.
Yes, sir.
But internally, you can do the voice corrections by removing a polyps or papillomas. Papillomas is very common in children.
Sir.
Papilloma is commonest voice disorder in children. So we have to operate them.
Yeah.
Right? Sometimes
yes.
some children will come with a vocal cord cyst. They take therapy, and then after they come to us, so we find the stroboscope and do the voice. So unless you remove the mass, then give therapy, excellent result.
Yes, sir.
So vocal nodules, for example, soft nodules, they respond to voice therapy.
Yes, sir.
No surgery for soft vocal nodules.
Yes, sir.
We don't
Thank you,
do
sir.
no surgery. Only give
Hmm.
beautiful voice therapy. Change the voice pattern. Voice be a patient. Definitely they do recover. And if you operate a vocal nodule without therapy, it is a failure.
Oh,
It is a failure.
yes, sir. Yes.
That is all very important.
Yes. Thank you, sir. Very nice explanation, enlightenment.
So I think it should go into the minds of all the SLPs now today, and they should come forward into the field of voice. So all SLPs, they must become SLPV. So this is my message on your day of National Speech Languages Pathologist Day. SLPs, please become SLPV.
Yes, sir.
Sure, sir.
You bring SLPV in India, doctor. Bring SLPV in India.
Yes, sir.
Yes, sir. Yes, sir.
Please convey this message to all your colleagues.
Definitely, sir.
And also send this video recording to everybody. Let them
Sure,
see.
sir. Sure, sir.
So that
Sure.
who cannot attend today may know more about these things. They develop interest and they become SLPVs. A specialization SLP. Now today SLPV.
Yeah.
First time here we are hearing this word, sir. SLPV.
Yes, there are so many things.
Yes, sir. Yes, sir. Thank you. Thank you so much, sir. It is a very informative webinar, and you have showed all the videos wonderfully, pre-therapy and post-therapy videos, along with the surgical procedures and also the instrumentation analysis about the digital video laryngoscopy and dynamic endoscopic evaluation, everything. And moreover, the webinar started with a very new term, SLPV. It is very good for all of us. And for the audience information, I tell that Dr. Fanindra Kumar sir is the only ENT. So far, I have seen that he is giving 70% of the credit to the SLPs in the assessment and management of the voice disorders, and also encourages the SLP to do more and more in the treatment of voice disorders. And also, he came forward to conduct a certification course in voice and swallowing disorders for our TASALPA members. Thank you so much, sir. We are in the process of preparing the syllabus and all. And very soon, he will be going to start the program to all of us, and that program will keep continuing. And as Panindra sir is wishing everyone to become SLPV, sir, with your great support, I hope within coming few years we all will become SLP Swiss in the assessment and management of voice disorders. And also, sir, always tell that live and let live, because there are so many voice disorders where we can't do alone. I always believe this, it should be a team approach. ENTs and our SLP should go together. So wherever you feel that there is no improvement in the after the voice therapy, and wherever you feel there is a doubt in the case, you need some consultation from the ENTs, please feel free to refer to Dr. Fanindra Kumar sir. He will guide you, he will help the patient, and also refer back to you only. There are so many cases we are seeing outside in the market where if you send any patient to one of the specialists, he will again divert the patient to other therapists or other clinics. So he has given a clear, very good promise to all of us that he won't divert the patient anyway. He will help you throughout the success of this patient. So he will help you in the management, assessment, and as well as management, as well as post therapy or post surgery also. Is going to be with us. So believe him and also learn from him, and share your knowledge with him and learn knowledge from him. It is like live and let live. Always sir is telling the same point. Thank you so much, sir. And our honorable secretary, Dr. Imad Khan Rumanji, is also there, sir. Is also one of the founder and secretary of TASALPA. That day when we conducted the World Voice Day at Century Hospitals, he could not join that meeting because of the Ramzan. Rosa. Now I request Dr. Imad Khan Rumanji to give a vote of thanks and also your votes.
Hello, good evening all. It's a very kind gesture that sir has given his lot of time and is spending time with us and is interested in explaining the audiologist and speech pathologist about their role and practical systems available. So it is an honor to host him today. and we will be looking forward to work with you, sir. We are very thankful for your time and also the upcoming course as well. And we will look forward to work with you for more and more webinars and practical sessions in the coming days, sir. Thank you so much, sir.
Thank you, sir.
Dr. Nagendra, please kindly take a group photo.
Okay. I request everyone to switch on your videos.
So today you take a oath, you become SLPV.
Yes, sir.
Thank you, sir.
All our team members also joined, sir. Our Honorable Secretary and also our respected advisors, our EC members, and all the members of the team TESLPA joined. They all, I really thank everyone, and also all the members who have joined this webinar from different parts of the country. Thank you so much. We look forward to host so many informative webinars like this in future, and also we are eagerly looking forward to work with Dr. Phanendra Kumar, sir. Thank you, sir.
Thank you very much, sir. Have a great day, sir. We are blessed. Thank you all.
Thank you, sir.
Thank you, Dr. Nagendra, for
Thank you, sir. Thank you all.
coordination.
Thank you,
Once
Professor.
again, happy National SLP Day for everyone.
Thank you.
Sir, shall I close the meeting, sir? Any
Please,
other
please.
doubts?
With your permission. Thank you, sir.
Your permission, sir.
Thank you.
Right.